Hi, everyone, and welcome to the Clinics Review Articles podcast series. I'm Taylor Hayes, the managing editor for Primary Care Clinics and Office Practice here at Elsevier. Primary Care Clinics and Office Practice is a quarterly publication consisting of review articles focused on essential topic for primary care physicians. Today, we will be discussing the recent December 2023 issue dedicated to social determinants of health, guest edited by Dr. Vincent Morelli from the Department of Family and Community Medicine at Meharry Medical College, and consulting editor Joel Heidelbaugh from the Departments of Family Medicine and Urology at the University of Michigan Medical School. Hello and welcome to the podcast. Thanks for joining me today. I'd like to jump right into the first question. Can you list some social determinants of health to get us started? And when did social determinants first begin to impact health?
Sure, I can list some social determinants of health. The CDC and the WHO break it down into 5 basic categories. And those categories are access to health care, economic stability, the all-around built environment, the learning environment, and the social context. And the social context can include things like work, transportation. The economic category can include things like food security and so forth. All of these social factors, these non-medical factors, affect health in really an impactful way.
Thanks for listing those. I think it's important to start there. I remember when we initially talked about doing this volume, what I felt was so important and could be so impactful is to highlight all of these elements. We're going to go deeper here in a minute, I know, for not only the readers, but a broader audience, meaning medical education learners, students, residents, allied health professionals, but also students in undergraduate and graduate programs at universities that are studying the social sciences relative to healthcare. I think it's so easy to focus just on the medical issues that sometimes all of these issues in healthcare delivery that impact outcomes can easily be overlooked, but they're so relevant.
Great, thank you. And why did social determinants of health only recently come to the forefront? Did it have anything to do with COVID or was it something else?
I think there's multiple reasons. Certainly COVID and all of the very alarming statistics we saw relative to COVID that impacted morbidity and mortality allowed for some pause to take a look at healthcare disparities. But, we've looked at this before. We've thought about it before. I think in more recent years, it's gotten bigger attention because it's got to be more than about just the medicine. It's got to be about all the factors in the community, in the environment of our patients that ultimately impact and influence their healthcare outcomes. Dr. Morelli mentioned access is an important one, the built environment, a lot of community elements. I think we've been talking about it. I think fortunately there's been more effort in research and more effort in at least attention toward publication and getting these things out there to interweave these elements with medical care outcomes.
Thanks, Dr. Heidelbaugh. Yes, it's come to the fore now, I think largely because this is where we can make the biggest impact, especially in developed countries. We're no longer worried about infectious diseases like we were in the past, but now this is where we can make our biggest impact. And as primary care physicians and those involved in the social sciences, we need to be more aware of it. It's really got an interesting history behind it. Social determinants have always made an impact on health. If you go back to the agricultural revolution back 10,000 years ago, you see the first evidence of increased violence and increased infectious disease in the archaeological remains of people. These social determinants have always been there. When we go, even to the Industrial Revolution, for example, in the 1700s, and there was, rampant pollution and and those kind of things taken off. It was so remarkable that one of the prominent physicians of the time, Virchow, said that, do we not always find that the diseases of the populace are traceable to defects in society? And that was 1848. So it's always been there, but it's just come, to the fore right now as we realize where we can make our biggest impacts.
And what are some of the current manifestations of social determinants of health that are seen in primary care?
Well, this is an easy question for Dr. Morelli and I, because as primary care clinicians, our lenses are wide enough to be astute to look for this and address this in essentially every patient every day. I'm fortunate to have a practice in a small suburb of Ann Arbor, Michigan, very multicultural practice, and sizable immigrant population. Over half our patients have Medicaid. There's just no way to see a patient without really, again, back to the principles of family medicine, looking at the biopsychosocial model of this. Every single patient, every single day. I was so impressed. A medical student said a couple of years ago, we really don't teach social determinants of health in medical school. And the first time I heard that, I kind of thought it was ridiculous, but they were right in the sense that the focus is so much on the pills and the tests that we have such a great and robust opportunity to dive deeper into this. And I think we're making headway with this on the community level, on the individual level, and there's really just no way to get through a single patient encounter without addressing this.
I'll add to that, we see all of the modifiable health outcomes that we see every day. The 40% of those are caused or can be improved by improving the social determinants of health. What we do clinically is only impactful to 20% of modifiable health outcomes. If you want to go even deeper, 72% of all preventable deaths can be eliminated by fully addressing social determinants of health, which is a pretty wild statement. Yeah, if you look at it in a different way, we have 5 times greater risk of liver, kidney, cardiovascular disease, cancer disease, post-surgical complications, et cetera, if we address social determinants of health. Yeah, when we see this all the time in primary care, but they also see this in specialty care. In cardiology, it's become so apparent that in 2015, the American Heart Association came out with their position statement saying, and I'm quoting this, the most significant opportunities for reducing death and disability from cardiovascular disease in the United States lies with addressing the social determinants of cardiovascular outcomes. So even the specialties are becoming aware that this is an acute and correctable problem.
And I just wanted to see if we could close the loop on the education point. Are either of you able to provide specific ways that education has adjusted to teach providers to consider these social determinants of health?
I can comment, at least through the American Academy of Family Physicians and our national clerkship curriculum through Society of Teachers of Family Medicine. This is a line item. This is important. This can't be overlooked. It's easy enough to say, we're going to teach you about hypertension. Here are the medications, and go to the gym and lose weight. Ultimately, you're missing the point with a lot of that. If we're looking at the social determinants of health, and if we're looking at this at an individual and a community level basis, identifying those, if you're going to make modifications, that probably has greater impact than anything else. So education is really coming around. And again, I'm going to speak about medical education, but I think this is much, much broader. To realizing the importance of this, each medical school is going to be situated in its own community, and across the 180 or so medical schools in the country, obviously that's going to look quite diverse. With the element of infusing this more into education, programs that focus on patient-centered medical home models, patient-centered care, community-based medicine, really allow for that kind of integration. Outside of medical education, in the social sciences, it's not just about doctors. We have so many allied health professionals and allied researchers and teachers who play a role in teaching all of this and working to improve all of it.
Pivoting back to our original conversation, how do primary care physicians screen for social determinants of health?
That's a great question, and it's an area of ongoing discussion, how best to screen for social determinants of health. All of our academies, the American Academy of Pediatrics, the American Academy of Family Medicine, et cetera, they all recommend screening. That said, they don't know that there's a lot of problems with screening. They don't know the exact way. There isn't a uniform tool to screen, but usually it's some type of a survey. And we're trying to get to a point where we have a universally accepted, validated survey so that we can provide intervention in an evidence-based fashion. There are a lot of physicians out there practicing who are concerned that if they screen for these social determinants of health, they better have some way to address them. And not all of them feel educated enough or equipped enough to address these types of issues. Even, pediatric practices who tend to be more attuned to social determinants because since the early 2000s, they've been attuned to adverse childhood experiences affecting health. But even these enlightened pediatric practices, only 25% will screen for social determinants. So the reasons for that are, lack of a universally validated screening tool, doctors feeling ill-equipped to handle referrals in this fashion, and time constraints, et cetera. So even though we know it's the right thing to do, it's an evolving area that we're working on.
Yeah, that's very well stated. And I'll just briefly add to that. I think we're doing better. I've heard from colleagues around the country that we need to be asking all of these questions. And in a lot of practices, and starting to laugh a little about my own practice, because it's not uncommon to hand a patient 4 sheets of paper when they walk in the door asking all these questions, or certainly there's integrated tools depending on your medical record system. And so it's how many questions are you going to ask and what have you. I think one of the challenges with this is, what do you do with the information, and do we have the resources to be able to, I'm going to say, address them, but also impact them in a way that we can improve upon them to improve healthcare outcomes. That's saying a lot. Not that we shouldn't be asking all of these questions. We certainly should, and there's probably more questions that we should be asking. The question is, how do we balance all of this, and how do we address all of this in a single office visit, which is a much broader question.
What can primary care physicians do to improve social determinants of health besides screening?
Again, I think it just gets back to the individual patient. Each patient's an individual. Their life is in evolution. Things change. Certainly, we're always going to be talking about COVID and the impact of COVID, but there's lots of things and lots of life changes that people go through that their social determinants impact, and vice versa. I think it starts on the individual level, and I think the beauty of primary care is our longitudinal relationships with patients. Not that the subspecialists don't have that, but they don't have it to the degree that we do. So I think it's about asking the questions. I think it's about forming a longitudinal relationship. And then it's about patient-centered medical home models. It's about what kind of resources do you have. Different practices are set up different resources. And it's one at a time. It's one at a time. I'm thinking specifically about a patient who I brought into my office 3 times in the last 4 weeks. She's going to have surgery. The first visit was very simple in terms of she needed preoperative clearance, but it obviously wasn't simple, and we have to get some things under control before she has her surgery. Why is it so difficult to do that? She's got a lot going on. And so we're focusing on the social determinants than the actual medicine, because if we're working on improving those social determinants, everything else often falls in place, and we can help with that. It has to do with housing instability. It has to do with food insecurity. It has to do with losing potentially losing a job, and is getting surgery around the time of all of this the right thing to do. So as we're able to do this on an individual level, I think it speaks volumes for what we can do on the community level.
Again, that was fantastic. I would add to that even the USPTF, the Preventative Medicine Task Force, wants primary care physicians to be at the forefront of this. And the reason is we are the ones that have the longer term trusting relationships and can approach these questions, which can be really seen as an invasion of privacy if you don't have that relationship. So we're uniquely positioned to do that.
Why are primary doctors situated best to intervene, and why is it important to do so?
I think it's the hallmark of primary care, especially in family medicine. I don't think you can separate a biopsychosocial model approach to patient care without heavy integration of the social determinants. And that includes understanding them, recognizing them, and then having systems in place to be able to try to address them. Doing that in one single 20 or 30-minute visit, I think is a gargantuan task. That being said, I know that a lot of our subspecialty colleagues work to address these things, often when they don't have the level of the continuity of care that we do in primary care. But certainly in primary care and family medicine, this is the foundation upon which we're built.
Is there anything else that you'd like to discuss?
I wrote a chapter in our Elsevier publication on this with Dr. Robert Heiselman from University of Michigan. And there are a bunch of ways that we're looking at monitoring social determinants. One is this GIS mapping, where you map different neighborhoods, zip codes, if you will, and you'll monitor for violence and air pollution and those kind of things, and then correlate those with health. And then when you see patients coming in from those areas, you'll be a little more attuned to what may or may not be happening in those environments. So GIS mapping is one way that we can monitor. But the real exciting stuff, I think, is coming in the future. And these are looking at biomarkers of inflammation. Anytime you have any kind of stress from these social determinants, you're just a little more on edge. You have higher cortisol levels and so forth. And we're going to be able to monitor both hormonal changes in the hypothalamic axis, and we're going to be able to monitor cellular changes in fascinating ways. If you're a chemistry geek, it's really fascinating what they're doing now. And we're going to even be able to monitor some intracellular and genetic changes. We can see these changes on the cellular level really easily. Visually, we can see these changes. We can see intracellular genetic DNA methylation patterns that reflect stress. We can see cellular circulating stress granules, which are essentially ribosomes that have stopped turning out good proteins and are now so stressed that they are granules that are non-functioning. But all of this stuff is really exciting in the future, I think. And, we'll be able to monitor. Telomere shortening is also really prevalent in people with adverse suboptimal social determinants of health. And telomere shortening is directly related to the aging of cells. So all of these things are going to be really exciting to monitor as we go forward. None of these are quite ready for clinical use, although they're in use in laboratories and research labs throughout the country. But there will come a time when we'll be able to monitor it objectively through a blood test.
Yeah, it's amazing. I mean, it's easy for Dr. Morelli and I to live in our family medicine worlds, but the social determinants element of this goes way beyond primary care medicine. This is obviously important in social sciences, but this, like he just alluded to, is certainly getting into levels of science and molecular biology in the future that's going to really be exciting. And I think we have a lot to continue to learn.
Thanks so much for taking the time to speak with me today, and thank you to our listeners for joining us for this edition of the Clinics Review Articles podcast series. We hope this issue and podcast were helpful for teaching aspects of social determinants of health. For an exclusive discount on the issue we discussed today, focusing on social determinants of health, visit us.elsevierhealth.com/expert. Primary care clinics and office practice is available for individual print subscription with accompanying online access, as well as individual online-only access, and is also available on the Elsevier electronic platforms Clinical Key and Science Direct. For more information on this series and our nearly 65 other titles spanning all medical disciplines, visit info.theclinics.com. Be sure to follow us on Twitter at Clinics Reviews and subscribe to the Clinics Review Articles podcast series wherever you get your podcasts. Thanks for listening.